Food trouble, allergy, or intolerance. Food, glorious food. It's something we all love and need to survive. We need it to live, to thrive, and to enjoy life. But sometimes our bodies react strangely to certain foods, causing confusion and discomfort. Is it a food allergy? Allergies can be severe and even life-threatening. Or is it an intolerance? Intolerances are usually less severe but can still cause significant discomfort. Let's find out. Imagine this. John eats peanuts and starts feeling itchy all over. His body is reacting in a way that suggests an allergy. He might have a peanut allergy, which can be confirmed through medical tests. Now, imagine Sarah drinks milk and her stomach feels upset. This is a common reaction for many people. She might have a lactose intolerance, which means her body has trouble digesting lactose, a sugar found in milk. Allergies and intolerances are different. Allergies involve the immune system, while intolerances involve the digestive system. Knowing the difference is important for staying healthy and making informed food choices. Let's explore these differences together so you can enjoy your meals without worry and live a healthier life. Food allergies. When your body fights back. Food allergies happen when your immune system, your body's defense system, overreacts to a harmless food. It's like your body mistakes the food for a dangerous invader. When you eat a food you're allergic to, your immune system releases histamine and other chemicals. These chemicals cause the uncomfortable symptoms of an allergic reaction. Remember, even small amounts of the food can trigger a reaction. It's vital to avoid the foods you're allergic to. Serious allergic reactions can be life-threatening. Red alert. Allergy symptoms you should know. Food allergy symptoms vary from person to person. Some people experience mild symptoms, while others experience severe reactions. Common symptoms include skin rashes, hives, itching, and swelling. You might also have digestive problems like nausea, vomiting, or diarrhea. In severe cases, you can experience difficulty breathing, wheezing, or a drop in blood pressure. This is called anaphylaxis. Anaphylaxis is a life-threatening emergency that requires immediate medical attention. Food intolerances, digestion, distress signals. Food intolerances are different from allergies. They don't involve your immune system. Instead, they are problems with how your body digests certain foods. Imagine your digestive system is like a machine. When you have a food intolerance, a part of this machine isn't working properly. This can cause discomfort, but it's usually not life-threatening. For example, lactose intolerance is a common food intolerance. People with lactose intolerance have trouble digesting lactose, a sugar found in milk and dairy products. Intolerance troubles. Spot the culprits. Food intolerances can be tricky. Identifying the culprit food often involves a bit of detective work. Common culprits include dairy products, gluten, found in wheat, and certain sugars like fructose and lactose. Symptoms often appear gradually, hours after eating the problem food. This makes it harder to pinpoint the cause. While uncomfortable, food intolerances are usually not life-threatening. However, they can significantly impact your quality of life. Allergy versus intolerance. Spotting the difference. Let's recap the key differences between food allergies and intolerances. First, the immune system. Allergies involve the immune system. Intolerances don't. Next, the severity. Allergies can be life-threatening. Intolerances are usually not. Then, the symptoms. Allergy symptoms appear quickly. Intolerance symptoms are often delayed. Finally, the trigger amount. Even tiny amounts of allergens can trigger a reaction. Intolerances are dose-dependent. Understanding these differences is crucial for proper diagnosis and management. Finding the root of the problem, tests and treatments. Understanding the underlying cause of your symptoms is crucial for effective management and relief. If you suspect you have a food allergy or intolerance, see a doctor. It's important to seek professional advice rather than self-diagnosing, as symptoms can often be misleading and similar to other conditions. They can help determine the cause of your symptoms and recommend appropriate tests and treatments. A thorough medical history and physical examination are often the first steps in this process. Allergy testing usually involves a skin prick test or a blood test. The skin prick test involves placing a small amount of allergen on the skin and pricking it to see if there's a reaction. These tests can identify specific allergens. Blood tests measure the amount of allergy-causing antibodies in your bloodstream, providing a clear picture of what might be triggering your symptoms. Treatment for food allergies involves avoiding the trigger foods and carrying an epinephrine auto-injector, like an EpiPen, in case of accidental exposure. It's also essential to read food labels carefully to avoid hidden allergens. Diagnosing food intolerances is trickier. Unlike allergies, intolerances don't involve the immune system and can be harder to pinpoint. It often involves keeping a food diary and eliminating suspect foods to see if symptoms improve. Working with a nutritionist can help ensure you're still getting the nutrients you need while avoiding problematic foods. Treatment for intolerances usually involves dietary modifications to avoid the problem foods. This might include finding alternative ingredients and learning new recipes to maintain a balanced diet. Listen to your body. Seeking expert help. Living with food allergies or intolerances can be challenging, but it's manageable with the right knowledge and support. Don't hesitate to seek professional help if you suspect you have either condition. Remember, early diagnosis and management are crucial for minimizing symptoms and improving your quality of life. Pay close attention to your body's signals and seek expert advice to navigate the world of food sensitivities safely and confidently. Living well with food. Sensitivities. Living with food sensitivities requires vigilance and careful planning. It can be challenging, but with the right approach, you can still enjoy a wide variety of foods. But it doesn't mean you have to miss out on enjoying delicious and nutritious food. There are countless options available that cater to different dietary restrictions. Here are a few tips for living well with food allergies and intolerances. These strategies can help you navigate your dietary needs with confidence and ease. First, read food labels carefully. Always check the ingredient list for potential allergens. This is crucial for avoiding foods that could trigger a reaction. Second, inform others about your allergies. Let friends, family, and restaurants know about your allergies to avoid accidental exposure. Communication is key to ensuring your safety. Third, explore alternative recipes. Many delicious recipes cater to specific dietary needs. Experiment with different ingredients and cooking methods to find what works best for you. Lastly, connect with support groups. Sharing experiences and tips with others can be incredibly helpful. You can find support groups both in person and online, where you can exchange advice and encouragement. By understanding your condition and taking proactive steps, you can live a full and enjoyable life despite food sensitivities. Remember, knowledge is power, and with the right information and support, you can thrive.